some treatment. Side lying position for the forearm, wrist, and hand with a little bit of the shoulder. I have my client into a side lying position right now. I'm just going to tuck the drape underneath her arm like so. So just for reference, I have one pillow for her head, I have one pillow for her to hug, and I have a bolster in between her knees. This is really beneficial for clients who are uncomfortable with lying in a prone or a supine position. Also really good to help take the weight and pressure off of the shoulders and the back. Just gonna check the camera position. That looks good. So we'll cover the treatment of a couple of different conditions. Right now we're working a little bit on the forearm extensors. Starting off with a little bit of fascial work. So I did a little skin rolling to start. And then just sort of doing a little bit of fascial spreading in across this area. Do a little bit of an espo. A bit of muscle separation. Pick up those extensors. So I'm just sort of using my thumb and my index finger. I'll roll my index finger underneath the muscle belly. And I'll use my thumb to sort of separate it from the rest. So just working to try to peel that brachioradialis off of the extensors. My client does frequent desk work. Has for probably the past 10 years. So this is usually a pretty good area to treat. Something fun you can do with your client with the forearms. You can use an old schoolyard trick. Basically grab the forearm with both hands and we'll wring it out as if we're doing a snake bite. Go the other way. Feel a lot of that fascia popping underneath our hands. Does it feel okay?
Amazing.
Amazing, she says. So yeah, give it a try. All right. I'm gonna do a little bit of joint play for the arm, or for the elbow. Best approach this. So I'm just doing a little bit of a distraction on the elbow. A bit tough to do from a side-lying view. There we go. Should have braced my arm up against the table. Ideally not the best for body mechanics, but we do have this elbow into its resting position at about 70 degrees. Let's see, the only thing wrong with this is maybe I'll want to change my wrist. There we go. That's pretty comfortable. So we're still sort of going in a bit of a swooping motion here to make sure that we're really distracting those surfaces. Indeed, see the client's hand. Perfect. All right. So looking at the wrist, we're doing a little bit of joint play. Remember that we're looking at a roll and glide in the opposite direction, so convex moving on concave. So what we'll need to do first is we'll need to just distract the surfaces of the radiocarpal joint a little bit. We can stay like this, or we can glide in a specific direction if we're looking to increase a specific range. So if I move this into a dorsal, if I do a dorsal glide, I'm going to be increasing extension, or excuse me, I'll be increasing flexion. So let's do a bit of a sustained hold here, maybe about a grade 2. Being careful not to lever the joints and not bending the wrist. Stabilizing and mobilizing. So stabilize with this hand, mobilize with the distal hand. Oh, we just felt a good release in there. Wonderful. If I wanted to increase extension, I would just distract and do an anterior glide. You can also do radial and ulnar glides. A radial glide will increase ulnar deviation, an ulnar glide will increase radial deviation. All right, we can do a little bit to distract the phalangeal joints as well. Just careful you're not pulling too hard, or else you'll get a little bit closer into chiropractic adjustment mode. Sometimes what I'll do is I'll just give a little bit of a distraction and do a little bit of side, a little bit of back and forth. Well, I guess not back and forth, a little bit of side to side. Do a little bit for the thumb as well. All right. So I just got some basic massage lotion here. Warm it up with our hands. And we'll start our plight. The pillow that she hugs is really the best part about sideline. So it's going to give her shoulder a ton of extra support and will basically cover the entirety of the chest. A lot of extra layers of coverage here. And it just feels really nice. So starting off, a little bit of work into the deltoids. Just gonna give this a bit of a better tuck. And starting off with a little bit of a sort of stripping along the perimeter of the deltoid. Depending on your intent and your approach here, this sort of stripping technique can be seen as, well, stripping, or can be a really excellent muscle separation technique. So you can work to sort of peel the posterior fibers off of the neighboring tricep. A little bit of SIBO on the mid fibers. Switching to a little bit of stripping. And I'm going to leave the interior fibers alone because that's done a little bit better with a pec and neck treatment, which we're going to stay focused on we're going to be focused on the upper limb today. We'll do a little muscle separation on the bicep, get into the brachioradialis, the brachialis. Another benefit to the cushion here, or to the pillow, is I can rest my hand right up against here and not be anywhere near my client's chest. So remember, the brachialis is one of the primary elbow movers. Lies underneath the bicep brachii, so I'll have to move bicep out of the way in order to get at it. How's the pressure? Give a little bit of the same attention to the tricep. I find people are a little bit dominant in one side or another. You get people who have jobs where they have a lot of pulling. Oftentimes their biceps are going to be better developed. People who push, often going to have bigger triceps. I'm just grabbing onto the wrist, mainly because I just don't have anywhere better to put my other hand. But as I do this, I'm either doing a stripping technique or I can apply my entire flat hand to it and it just make more of a slow effleurage. It's almost like I'm doing a little bit of a distraction to the wrist while I'm doing it. So in and around here, we're going to have the supinator muscle. Supinator muscle makes up the radial tunnel, which the radial nerve passes through. The radial nerve doesn't get nearly as much attention as, let's say, the ulnar and the median nerve do. Probably just needs better PR representation. But I'll do a little bit of transverse work along the supinator muscle to get it loosened up. Just in case that radial nerve isn't trapped. Right near, we also have the common extensor tendon. So we can do a little bit of friction circles to warm that up. Still in a little bit more of a Swedish application, but strip along that tendon. We got a good adhesion there, so let's do a little bit of cross fiber friction to it. Upon completion, we'll apply ice. Definitely flush it out. And we'll do a little bit of a pin and stretch on that tendon. I'm gonna hold it here because it feels like it needs it. Stretch okay? Cool. Just gonna move the wrist into a little bit of passive flexion and extension while we're doing this. A little bit of movement, and it helps amplify the effectiveness of the technique. We'll do a little bit of ulnar and radial deviation for this one. It's not really going to hit the muscle, but a little bit of movement into the wrist is not a bad thing. Strip out the brachioradialis. It's very crunchy. Take our time a little bit at the distal half of this muscle because it feels like it needs it. Hopefully by this stage of your training, you're starting to feel a little bit more of what the body needs. Your hands sort of do some of the work for you. As far as thinking about what to do with your next technique, obviously your hands are doing most of the work for you. Now that we've loosened things up a little bit, I can actually feel the space in between the radius and the ulna. So I'm just going to do a little bit of alternate compressions on the borders of the bone, just to get a little bit of movement into there. Does it feel okay? Cool. I've never actually really done this technique. Just sort of jumped into my mind. Like, hey, this would be cool to try. Should flush this all out. Do a little bit of work into the flexors. For demonstration purposes, it'd be a little bit better if I had my client's other arm, but you can still see here, common flexor tendon. We'll take a little bit of a look at that pronator teres muscle. Give it a little bit of lengthening. So we know that that's one of the areas where the median nerve can become compressed. Strip out the forearm flexors. Ooh, that was a good jump. It's from this position, it's really decent for side lying because you can let the weight of the client's arm apply some of that pressure for you. Ooh, yeah, that's a nice spot right there. Okay, so I'm gonna hold a little bit of compression. So my thumbs here are just sort of stabilizing the arm. Whereas on the other side here, I have stacked hands that are likely taking care of fascial adhesions, perhaps I don't know, maybe a thumb muscle. Pronator quadratus maybe. Definitely felt like I needed it. All right, do a little bit of work into the hand here. So what I really like doing, for a fellow classmate of mine referred to this as breaking open a dinner bun. So I'm just going to hook my fingers here at the flexor retinaculum, give that a good spread. You can go from the flexor retinaculum over to the Guyane canal. So good for median and ulnar nerve impingements down in the hand. You'll of course want to address the flexor carpi ulnaris if you're looking to get into, looking to treat into some cubital tunnel. I'll strip in and along the distal radial border of the forearm here so I can get into some of those thumb muscles. Do a little bit of a stretch on those, snuff box tendons. You feel okay? Do you feel the stretch?
A little bit.
A little bit? Let's try and fix this. We'll go thumb across midline. How about there? Good. So just got a good stretch across those tendons here. Hold that for a little bit. Let's get a little bit into that thumb flexor. Get into the lumbricals here too. And just a little bit of a passive stretch. So keep the elbow in an extended position. Just give a good stretch across there. It's not too much work for the wrist to go into that extended position, but the fingers are definitely taking a little while. That's okay. Took that a little too far. Is that better? And we'll just do a little bit of compression broadening across the dorsal surface of the hand. Just bring some blood flow there. Catch the extensor retinaculum because that doesn't get enough love. And we'll just work our way up. Flush this out. Shake. There we have it.